Right, so let's take you now to the Competition Commission, which is investigating pharmaceutical company Johnson & Johnson on whether it overcharged South Africa for TB drug Bedaquiline. It's emerged that other countries were paying far less for a 6-month course of the drug. Joining us is Khadija Jamaloodien, who's the Chief Director for Affordable Medicines in National Health Department. A very good morning to you. Thank you so much for your time. Perhaps let's start right at the beginning. Talk to us about what was uncovered about Johnson & Johnson and this life-saving TB drug.
So good morning and thank you for having me. Just to give a little bit of history about Bedaquiline, it has been on the market since 2013 and registered in South Africa in 2014. So technically it's been available to the South African population since 2014. We have had some programs that made the medicine available under access programs. But recently we've also issued a tender for Bedaquiline as it has been included in our TB regimen for drug-resistant TB. We've awarded a contract which is available in the public domain. The prices are available in the contract. Contract price is available in the public domain. But also, the Global Drug Facility has also issued a tender for the Bedaquiline. And that is to make Bedaquiline available to a number of low and middle income countries. And what was discovered was that the price at which the Global Drug Facility was able to access the medicine is much higher than what our contract price is. And that's where the conversation started.
So what challenges has this now presented in ensuring that the treatment of those who desperately need this life-saving drug, what impact has it had on their treatment with the price, the hefty price supposedly that was paid?
So the biggest impact is on the available budgets. I think people are aware that we are in a very resource-constrained environment currently, with a number of budget cuts being announced. So we have to make sure that we have as efficient pricing as possible. The higher the price, the less that you can buy, which means that the fewer number of patients that we can reach. So within our current financial, budgets, we are only able to buy X amount, which means that anything more than that, we will not be able to reach those patients.
What outcome are you hoping for here as the Competition Commission has now taken on this case in ensuring and really just investigating what health advocates maintain that other middle-income countries are able to buy the same drug but pay far less for it?
So in terms of the contract that we do have, we can ask Johnson & Johnson or Janssen to reduce their prices aligned with the global international prices that we have been seeing. We've reached out to them in that regard and we're waiting for their response. The kind of response we are expecting is that they will voluntarily reduce the contract price aligned to the international prices. And that will allow us to buy more of the Bedaquiline so that we can reach more patients and save more lives.
Very well. Khadija Jamaloodien, Chief Director for Affordable Medicines in National Health there. Thank you so much for your time, giving us a breakdown of the competition watchdog probing whether Johnson & Johnson overcharged South Africa for a life-saving TB drug.